everyone, I'm Lara Ray. I am a clinical psychologist and professor of psychology and psychiatry at UCLA, and I have been researching and working with patients with alcohol use disorder for the past 20 years. So I've been very invested in learning more about alcohol use disorder and using that knowledge to help patients who are struggling with excessive drinking. What I want to do today is share with you some of what I've learned and give you some resources so that you may be able to consider ways to change your own drinking or perhaps to help a loved one who's struggling with excessive drinking. So I'm going to share some slides with you today, and I'm going to cover the basics of alcohol use disorder. I want to start by sharing with you some disclosures. Most of my research has been funded by the National Institute on Alcohol Abuse and Alcoholism. I do study medications, but I will not be speaking about those experimental medications today. And as I said, I've been in private practice as a licensed clinical psychologist since 2008. So I want to start with a simple question. What is alcohol use disorder? Well, we think about alcohol use disorder as a brain and behavioral disorder where individuals continue to drink heavily despite a host of negative consequences. And those consequences could be health related, such as liver disease, psychological consequences, not sleeping well, feeling more anxious or depressed, and a host of social consequences, such as complaints from significant others, loss of jobs. Sometimes individuals will lose some of those strong personal relationships and they'll go through a divorce that is related to excessive drinking. Now, we believe that part of what makes alcohol use disorder brain related is that continued and heavy drinking causes changes in brain circuits, and those circuits are important in experiencing rewards from life, how we feel, our mood, our affect, and also how we make decisions. So we believe there's a strong brain-based component to alcohol use disorder, but of course that's not the entire picture. Now, remember, before one can reach an alcohol use disorder and an addiction, we start by drinking alcohol, and many people can drink socially for their entire lives. Then a lot of individuals will transition into heavy drinking. Heavy drinking is considered for females having 7 or more drinks per week, and for males, 14 or more drinks. Another way to look at heavy drinking is the frequency of binges. So for females, drinking 4 or more drinks on one occasion, and for males, 5 or more drinks in one occasion. The quantity per week and the frequency of binge drinking are two indicators that the individual has kind of moved into this heavy drinking category. As you can imagine, the heavy drinking category predisposes you to alcohol problems. These alcohol problems, however, start in a more mild fashion. Some individuals develop 1 or 2 problems related to alcohol, 1 or 2 symptoms of alcohol use disorder. And as they have 2 or more symptoms, we call this an alcohol use disorder mild. With more symptoms, 3 to 4, we upgrade the disorder to an alcohol use disorder moderate. And finally, with 5 or more symptoms, we call the alcohol use disorder severe. Now, this distinction is important for psychologists and doctors to really understand the severity of alcohol use disorder, but it's also important for individuals who are in the midst of heavy drinking to understand that the changes will be easier if you can transition your drinking away from heavy drinking, or if you start to make changes at a mild level of alcohol problems. So clearly we don't need to wait until problems become so severe that they might require more medical attention. Now, why do some people develop an alcohol use disorder? That's a question I get a lot, and I actually think a lot about that in my own research. Some individuals can remain social drinkers for their entire lives, while others will transition to alcohol problems and will develop an alcohol use disorder. So what are some of the risk factors that we know as scientists and psychologists and researchers? Well, early initiation is clearly a factor. In fact, individuals who have their first full drink under the age of 15 are at a greater likelihood of developing problems in their lifetime. Another factor is what we call innate tolerance. Some individuals, their bodies can really handle more alcohol. They might be proud that they can drink others under the table. Well, that innate tolerance usually causes individuals to drink more heavily and expose their brains to more alcohol, which in turn will increase their likelihood of developing problems during their lifetime. Other individuals really find alcohol very rewarding. They really enjoy the positive, euphoric, mood enhancing effects of alcohol. And those individuals over time are also found to have a greater likelihood of developing alcohol use disorder. Now, as you probably know, there are genetic factors associated with alcohol use disorder, and family history is one of the ways that we look at genetics in a more broad perspective, like having individuals in your family of origin that have experienced problems with alcohol will predispose you to develop problems yourself. Now, of course, environmental factors play a big role. Being in environments that are conducive to heavy drinking will promote exposure to alcohol, and heavy drinking levels, as I said, have the opportunity to alter brain structures that make you more motivated to seek alcohol and ultimately to develop problems. Now, finally, it's important to recognize that oftentimes individuals use alcohol to cope with anxiety and also to alleviate some negative moods. So oftentimes alcohol use disorder is going to be comorbid with anxiety and depression. Another way to talk about what I just reviewed in terms of vulnerability is this nice slide that really emphasizes a number of the factors I just mentioned. So we start with biology and genes, we look at environmental factors, and this slide is not specific to alcohol, but it's used by the National Institute on Drug Abuse to look at vulnerability for substance use disorders more broadly. Then you have the effects of the drug, in this case alcohol is our drug of choice, and that's having effects on the brain. And ultimately, at the more severe cases, we have what we know as addiction. Now, I get asked this question a lot, and I want to cover this with you. Can one recover from an alcohol use disorder? The answer is yes, you can certainly recover from an alcohol use disorder. One slide that I want to show you is comparing the recovery from alcohol use disorder to the recovery from other chronic conditions. So depending on how you see alcohol use disorder, either as a chronic condition or as a single episode in your life, you might have different expectations for what recovery may look like. Now, scientists like myself are interested in the idea that alcohol use disorder and substance use disorders may be chronic disorders. So here we're looking at percentage of patients who relapsed, and we see a lot of relapse. At least half of the patients with substance use disorders, including alcohol use disorder, will relapse. But relapse rates are also high for other chronic illnesses like asthma or hypertension. So it's really important for us to think about recovery as a lifelong process. Another question I get a lot is what's out there? What are the treatments that scientists have been working on for years that can really give you a leg up in recovery? So we have medications that are approved for the treatment of alcohol use disorder. Those medications include disulfiram, naltrexone, and acamprosate. A lot of clinicians are also comfortable using novel medications off-label, even though they're not directly approved for the treatment of alcohol use disorder. Your provider may feel comfortable with some of the newer medications that are currently in development. But with naltrexone, acamprosate, disulfiram, you have a nice leg up in recovery and the opportunity to really have what we call medication-assisted treatment. Now, behavioral treatments are very important. As a psychologist, I'm very committed to providing what we call evidence-based treatments, treatments that have been validated and studied under rigorous scientific conditions. To that effect, I want to emphasize cognitive behavioral therapy as really the gold standard for the behavioral treatment of addiction. So the combination of cognitive behavioral therapy and medications can also be very powerful. What about mutual help groups? Individuals who ask me, are you in support of AA? My response is absolutely. There is good evidence that AA helps individuals reach abstinence and stay abstinent if that's their goal. Not everyone wants to stay abstinent. Some individuals want to simply reduce their drinking and try to move to the social drinking category. So yes, mutual help groups have scientific support and should be part of the menu of options for individuals who want to change their drinking. Now, the treatment of comorbid disorders is very important. If your drinking is tied to an underlying anxiety disorder or mood disorder, we don't want to ignore the underlying comorbidity. We want to address any and every condition that might be contributing to your heavy drinking. Now, what about detoxification? Well, detoxification is needed if the initial abstinence, stopping drinking, cannot be reached safely without medical management. So individuals who have a history of significant withdrawal or seizures, they need medical management when trying to abstain. Individuals who are able to abstain on their own for 2 or 3 days may be better candidates for outpatient care and may not need detoxification. But that's a decision that you can come to with your provider. And finally, many individuals make changes on their own. As I mentioned earlier, we have a spectrum from heavy drinking to severe alcohol use disorder. And a lot of times individuals will tell me that they knew that they were headed for more severe problems and they decided to make changes on their own. And guess what? They can be quite successful. So we do encourage you to make attempts to reduce your drinking on your own and to seek help as appropriate. Now, finally, talk to your primary care provider. I think it's really important to know that addiction and alcohol use disorder and alcohol problems are part of the disorders that your primary care provider is prepared to address with you. So please do consult your primary care provider if you have questions about medication management or other resources to give you a leg up in recovery. Now, you might be saying, this is a great introduction, but I want to learn more. Well, I'd love to recommend a couple of resources for you. The first is called Rethinking Drinking, and here's a link. You can Google NIAAA, which is the National Institute on Alcohol Abuse and Alcoholism, and then type Rethinking Drinking, and you're going to be led to this really nice website that helps you do what's called a drinker's checkup. It helps you compare your drinking to population norms. It also helps you brainstorm some ideas to reduce or cut down your drinking. The second resource is the Alcohol Treatment Navigator. And again, it is a resource by NIAAA. So if you search NIAAA Alcohol Treatment Navigator, you should reach this very nice website that tells you more about how to be an informed consumer of treatments for alcohol use disorder. So I'm going to stop my screen for now, and I want to end on a positive note, thanking you for your attention. And I want you to know that as scientists, we're optimistic that with attention and focus on alcohol use disorder, we can really reduce the health burden of heavy drinking and alcohol use disorder in our communities. I hope that you've learned from this brief video, and I hope that you will consider the resources that are available to you through NIAAA. Thank you so much for your attention, and have a good day.